وبركاته. The third lecture of hepatobiliary system. We start with the first lecture, one introduction, other symptom of the biliary system is a jaundice. Now we give the last sequelae or one complication or end result from the different type of hepatitis or any liver injury and with the liver cirrhosis syndrome called liver cirrhosis. The liver cirrhosis, the end result from different pathological, chronic pathological of liver and with the liver cirrhosis. What do you mean by liver cirrhosis? The cirrhosis is a reversible chronic injury to the hepatic parenchyma that include extensive fibrosis with formation of regenerative nodules due to hepatocyte necrosis, collapse of the surrounding reticulate network with subsequent tissue deposit, distortion of vascular bed, and nodular regeneration of the remaining liver parenchyma. Okay, this definition. In other words, that means there is a chronic inflammation lead to formation of fibrosis. The fibrosis lead to formation of nodule inside the liver. There is a septal formation, separated different nodule. These nodule with fibrosis lead to change the architecture of the liver, lead to change the function of the liver called cirrhosis. This syndrome, cirrhosis, results from different type and the severity of cirrhosis differ according to the different cause of the cirrhosis. This picture, the left one and the right one, left the normal liver. This the left the cirrhotic liver. Sure. A change in the architecture of the liver, nodulity of liver due to chronic fibrosis and septal formation and nodular liver. Different cause of liver. What's the causes of liver cirrhosis? There is a wide spectrum of the causes lead to liver cirrhosis, from the common to the less common. The most common cause of liver cirrhosis is chronic hepatitis. Post-necrotic hepatitis, example, hepatitis B, hepatitis C, hepatitis D, and so on. Alcoholic liver disease. A chronic alcoholism can lead to the liver cirrhosis. A primary biliary cirrhosis. A primary biliary cirrhosis is inflammation of the biliary system and with cirrhosis. A primary cirrhotic cholangitis. Secondary biliary cirrhosis due to chronic obstruction of biliary system due to stones, stricture, or tumor inside the biliary system lead to chronic obstruction in the biliary cirrhosis. Hemochromatosis also. Wilson disease, alpha antitrypsin deficiency, and cystic fibrosis. Very, very rare. These cause the juvenile liver cirrhosis, also the cirrhosis. فهنا الترتيب causes from the common to the less common. The classification of cirrhosis classified according to the histological background into micronodular cirrhosis and macronodular cirrhosis, or mixed. When taking histopathology to the liver, cirrhotic liver, either micronodular, the most common in the alcoholic cirrhosis, characterized by regular connective tissue septa with regenerative nodule approximating size to the origin lobule, less than 1 millimeter in diameter. هنا شو تكون النوديول similar in size, small in size, regular, the same in size, called micronodular common cause alcoholic. The other macronodular cirrhosis common in the post-infective due to hepatitis B, C, or any chronic infection of the liver, in which the connective septa vary in thickness and nodular show marked difference in the size, with the large one contain normal lobule. That means the nodules are different in size. One small, other large with variable in size. Sometimes the largest contain many liver lobule. This is due to infection, hepatitis B, C, or viral hepatitis, while the micronodular or mixed between the two. When the causes are mixed, lead to mixed type of macro and micronodular cirrhosis. A clinical feature of the liver cirrhosis. What the symptom that present the patient to you complain from liver cirrhosis? Either many patients with liver cirrhosis may come to you asymptomatic. Firstly, maybe asymptomatic, can be but found incidentally at the surgery or autopsy in the patient with isolated hepatomegaly. اما انه خلال عمليه جراحيه ممكن نشوف عنده الليفر اللارج او نودولار الليفر وهو سيروسيس وما يعرف، او بعد الوفاه ممكن نشوف الكوز اوف death due to liver cirrhosis. او maybe in a clinical examination incidentally we find there is a large liver. The patient not complain any symptom, but when examined the liver there is a large. That mean the patient had liver cirrhosis. لما نسوي له other investigation نلقى عنده liver feature of liver cirrhosis, or come to you with non-specific symptom. Second, non-specific symptom include generalized weakness, muscle cramps, weight loss, anorexia, nausea, vomiting, upper abdominal discomfort, or abdominal gases. Non-specific GIT symptom may be present, a first presentation of liver cirrhosis. I'll come to you with hepatomegaly. Is a common but progress hepatocyte destruction may lead to fibrosis and shrinkage of liver and become undetected. So either hepatomegaly or sometimes the liver shrink become undetected, especially in the cirrhotic, post-infective cirrhotic liver. In the alcoholic, there is enlargement of liver. Autoimmune hepatitis, there is enlargement of, but infection due to hepatitis B, C, or B lead to, with time, progression, fibrosis, and decrease in size of liver and become small liver. So this third symptom اللي هي hepatomegaly. Or maybe there is jaundice, mild jaundice, not so severe. Only primary biliary cirrhosis is high serum of bilirubin, but serum bilirubin in the liver cirrhosis is mild because there is no active hepatitis, only fibrosis. So there is no chronic injury to the parenchymal liver disease. Endocrinal change, loss of libido, loss of hair. In the mean, there is gynecomastia, testicular atrophy, competence. These endocrine change due to the differ or change in the metabolism of the sex hormone in the liver. Due to failure of the liver, lead to change in the metabolism of sex hormone. Or circulatory change, there is a pulmonary arrhythmia. Cyanosis due to portal hypertension and pulmonary AV shunt inside the lung. Spider telangiectasia, or called spider nevi, seen in the upper chest. Hemorrhagic tendency lead to bruises, purpura, epistaxis, and menorrhagia in the female due to decreased synthesis of the coagulating factor, or in the chronic obstruction cirrhosis due to vitamin K deficiency, and lead to an activation of the coagulated factor 10,9,7,2. Or come to you with portal hypertension. One of the manifestation or sequelae of cirrhosis is portal hypertension. It's caused splenomegaly, collateral vessel, and they lead to capsmodosum or varicose bleeding. Esophageal varices lead to upper GI bleeding, hematemesis or melena, or come to you with hemorrhoid-like. When the portal hypertension as the end result from cirrhosis lead to the following: lead to splenomegaly due to congestion of the spleen, lead to esophageal varices and complication of esophageal varices, like hematomesis and malignant and blood loss، أو يجيك IV أو due to collateral shunt between the vein, portal vein, and the systemic circulation inside the rectum lead to hemorrhoid-like. Or fetus hepaticus. Fetus hepaticus, that bad smell, that smelling from the mouth due to inhaler of the substance that not metabolized by the liver. نسميه fetal hepaticus. Other complaint or other symptom of cirrhosis, ascites. Ascites due to accumulation of the fluid inside the peritoneal cavity. There is a different cause of the ascites, either due to portal hypertension, or due to hypoalbuminemia, or due to hepatorenal shutdown. All these lead to ascites. Other hepatic encephalopathy. Hepatic encephalopathy occurs due to shunting of the toxin from the portal vein to the systemic circulation that not filtered by the liver. When the liver fails, so all nitrogen substance that absorb from the intestine pass directly to the systemic circulation and not detoxicated in the liver. So when reach to the brain, lead to sign and symptom of the hepatic encephalopathy and the brain function disturbance. Other non-specific features include skin pigmentation, especially in the hemochromatosis, or clubbing of the finger, low-grade fever even without infection. So this table summarizes the lab abnormality or finding in the liver cirrhosis. AST والALT, liver enzyme or liver function test, we see the following. AST والALT are either normal or moderately elevated. دائما نشوف الليفر فانكشن تيست الليفر انزيم مايلدلي elevated او normal. دائما AST والALT increase more in the patient with active hepatitis when there is a liver injury. But in the liver cirrhosis, there is end with fibrosis. There is no active injury to the hepatocyte, so there is mildly elevated. An alkaline phosphatase less than threefold, but increase in the primary biliary cirrhosis or cholestasis function. مثل ما ذكرنا بالمحاضرة انه في ALT والGGT increase with obstruction or cholestasis. So GGT either more specific for liver than ALT وhigh in active colic نلقى اكثر. ليش؟ لانه increase with enzyme inducer، ومثل ما نعرف احنا الكحول هو enzyme inducer lead to increase GGT. So GGT alkaline phosphatase increase in the cholestasis of the liver cirrhosis. Bilirubin in the liver function test in the liver cirrhosis elevated later than GGT and alkaline phosphatase, important predictor for prognosis. هنا راح ندخل البيليروبين ضمن التشايلد بug classification of liver cirrhosis. البيليروبين either mild or later increase when there is increase more indicate bad prognosis and mortality more in the liver disease. Albumin level in the liver cirrhosis decrease. Why? Because the synthetic function of the hepatocyte decrease. So decreased synthesis of albumin. When there is hypoalbuminemia, lead to all sequelae of the hypoalbuminemia, example, fluid overload and ascites and pleural effusion. So the hypoalbuminemia also indicate the bad prognostic sign of the liver disease. Other prothrombin time. There is a prolongation of prothrombin time. Why the prothrombin time increase? Due to the following. Either due to decreased synthesis of the coagulating factor, due to failure of the liver or failure of hepatocyte. Other cause, in the case of primary biliary cirrhosis, there is a chronic obstruction lead to non-absorption of fat and fat-soluble vitamin and non-absorption of vitamin K. The vitamin K deficit lead to prothrombin increase. Other immunoglobulin increase, especially in the autoimmune hepatitis. Serum sodium unbalance, hyponatremia, and hypotonemia indicate the bad prognosis. Anemia are more common in the patient with liver cirrhosis. Anemia either due to chronic disease, anemia of chronic disease, or due to microcytic hypochromic anemia due to iron deficiency anemia in the patient, because the patient with liver cirrhosis commonly associated with bleeding, either due to bleeding tendency or due to upper GI bleeding, lead to chronic iron loss and lead to microcytic hypochromic. يعني الانيميا there is different type of anemia, either microcytic anemia due to blood loss or due to normocytic normochromic anemia due to anemia of chronic disease, or macrocytic anemia due to alcoholic. دائما alcoholic liver cirrhosis associated with macrocytosis. Thrombocytopenia and leukemia also manifested in the patient with liver cirrhosis due to hyperspllenism. Hyperspllenism اللي هو lead to increase anemia, decrease platelet and decrease white BC due to engulfed by a large spleen نسميه hypersplenism. All these lab finding can be seen in patient with liver cirrhosis. How to manage patient with liver cirrhosis? A treatment of non-cause. Any patient with alcoholic liver cirrhosis or effective cause of liver cirrhosis should be treated of the underlying cause. If the patient have alcohol, should be stopped of alcohol and alcoholic substances. If the patient hepatitis B, treatment of hepatitis B, treated hepatitis C accordingly. If the patient primary biliary cirrhosis, should be treated underlying cause, hemochromatosis, venosection, and chelating agent to the iron, a treatment of the cause. Or maintenance of nutrition, because the liver failure, the energy part that produced from the liver are impaired, so lead to catabolic state in the patient, lead to taking energy from the muscle, lead to muscle wasting, and the weight loss. Should maintain the good nutrition to the patient. The nutrition should be supplied by good nutrition, but should be avoid of the protein diet, because the protein diet may be associated with increased nitrogen substance and lead to hepatic encephalopathy. So, in patients with liver cirrhosis should take maintenance of good nutrition. A treatment of complicated liver cirrhosis. The complication of liver cirrhosis, like upper GI bleeding, or due to infection, example, infective peritonitis, or advanced liver failure, should be treated according to the underlying complication. An upper GI bleeding, a treatment accordingly. Infection by antibiotic. Liver failure may be liver transplant needed, and according. An end management of liver cirrhosis هي liver transplant. The liver transplant هي ال preferred treatment for liver cirrhosis, because the liver cirrhosis is irreversible damage, irreversible failure to the liver. So the treatment of choice هي liver transplant. Commonly, liver transplant done in cholestatic form of cirrhosis, example, primary biliary cirrhosis, or patient with alcoholic cirrhosis, cirrhosis due to hepatitis C. هذول الكيسز most commonly candidate for liver transplant. Or due to juvenile cause of the cirrhosis, example, antitrypsin deficiency or hemochromatosis, they well candidate for liver transplant. What's the sign that of the liver failure pointed to need for liver transplant? ما هي indication in the patient to be referred for liver transplant? Firstly, when there is sustained or increase in jaundice, more than 100 micromole, especially in the cholestatic disease. لما نشوف البيليروبين high in patient with primary biliary cirrhosis one indication for liver transplant. Other indication ascites or hepatic encephalopathy not response to the medical therapy. Third, hypoalbuminemia, severe hypoalbuminemia. ومثل ما ذكرنا الهايبوالبونيميا هي bad prognosis lead to more mortality. So hypoalbuminemia indicated for liver transplant. Four, fatigue and lethargy affected the quality of the life. In spite of treatment and conservative treatment, the patient lethargic and fatigue difficult to perform simple liver activities, should be indicated for liver transplant. Five, untractable itching and cholestatic jaundice, severe itching, severe pruritus and cholestatic disease. نعرف عند الباثوجينيسيس of the itching due to retention of the bile salt inside the skin lead to severe itching and the patient difficult to sleep from the itching. هاي واحدة من indication of the liver transplant. أخيرا هي recurrent variceal bleeding. The patient with upper GI bleeding due to the large variceal rupture with recurrent endoscopy and recurrent sclerotherapy and not response should be referred for liver transplant. The contraindication of liver transplant is the following: when there is generalized sepsis and septicemia, contraindication. Patient with HIV, contraindication. Extrahepatic malignancy. Patient with مثل colonic carcinoma metastasis to the liver أو lung cancer metastasis to the liver, contraindication of liver transplant. Active alcoholic abuse. انت البيشنت هو الكحول ليفر سيروسيس، روح سوي لي ليفر ترانسبلانت وهو اكتف الكحوليك، هذه difficult to do liver transplant. Cardio respiratory or renal dysfunction. The patient with heart failure contraindicated, renal failure contraindicated, respiratory failure all are contraindication for liver transplant. What's the prognosis of the liver cirrhosis? The overall prognosis is very poor. Only 25% of the patients survive 5 years from diagnosis. يعني 5% أو 25% بس يعبرون 5 سنوات. But when the liver function test is good, ممكن 50% survive 5 years and 25% survive to 10 years. إذا الليفر يعتمد على liver function test. If the liver function test poor, mortality poor or less. When the liver function very well, ممكن prognosis very good. What's the bad prognostic sign? ما هي الباد prognostic sign اللي احنا predict the mortality? Firstly, increase total serum bilirubin. When the serum bilirubin high, indicate the bad prognosis. Decrease plasma albumin, indicate bad prognosis. Hyponatremia, when the sodium less than 120, indicate bad prognosis. Fourth, prolonged prothrombin time. That means all the hepatocytes are destructed and decreased coagulating factor and prolongation of BT are very bad prognosis. Advanced ascites and encephalopathy. When the patient with liver cirrhosis present with ascites or liver cirrhosis present with encephalopathy are bad prognosis. إذا نعرف إنه الباد prognosis these 5 things. هنا خلوا classification of prognosis of cirrhosis in the table. وهذا التيبل أو scoring system اللي هو child buff classification of the liver cirrhosis prognosis. السكورينج يعتمد على the following parameter. encephalopathy either not or mild or marked. إذا ماكو encephalopathy نخليه 1 score. mild encephalopathy نعطيه 2 score. marked encephalopathy نعطيه 3 score. أكورد وهكذا. البيليروبين الليفل همينه less than 68 نعطيه 1 score. from 68 to 170 2 score. more than 170 3 score. الألبومين also if the albumin well more than 35 1 score. إذا من 28 إلى 35 2 score. إذا أقل من 28 جرام بير ديسيليتر نعطي 3 سكور. بروثرومبين تايم بير سكند، إذا البروثرومبين تايم أقل من 4 1 سكور. from 4 to 6 2 سكور، أكثر من 6 3 سكور. الأسايتس if no ascites 1 سكور. mild ascites by ultrasound 2 score. marked ascites 3 score. Accordingly, the child score either إذا جمعنا السكورينج سيستم، جمعنا كل السكور من الانكفالوباثي، بيليروبين، البومين، بروثرومبين واسايتس، لقينا أقل من 7 نسمي child A. من 7 السكور to the 9 نسميه child B. more than 9 child C. So the child A well prognosis, child B moderate prognosis, وchild C very poor prognosis. Accordingly, we classify the survival according to the child A, B, C. السرفايفل لو ناخذ 5 year survival، الchild A 48% pass the 5 year. Child B 20% of the patient may be only pass the 5 year. But child B only 10% of the patient pass the 5 year. That means very bad prognosis. According to this classification, child A may be in a conservatory treatment, but child B or C indication for liver transplant. According to this classification, we classify the patient need or not need to the liver transplant. Example of the biliary cirrhosis اللي هو example of the liver cirrhosis, biliary cirrhosis. Biliary cirrhosis classify either primary biliary cirrhosis or secondary biliary cirrhosis. The primary biliary cirrhosis affected the middle-aged female. The cause of primary is unknown. Immunological reaction is suspected because there is impaired cellular immunity and associated with a special antibody on other autoimmune disease. The cause not known, but mostly due to immunological reaction because associated with other autoimmune disease, example thyroiditis, celiac disease, and so on. The pathological region is a chronic granulomatous inflammation damaging and destroyed of the interlobular bile duct with the progressive inflammation and distortion of the biliary system. When there is overimmunity of the biliary system, lead to destruction of the biliary system inside the liver, and result to the fibrosis and distortion of biliary system lead to chronic obstruction in with the cirrhosis called the primary cirrhosis, commonly affecting the middle-aged female. The clinical feature of primary biliary cirrhosis, either non-specific symptoms, for example, the female come to you with anorexia, ill health, and fatigue, or come to you with pruritus, is the most common initial complaint pointing to the hepatobiliary disease. It may be preceded the jaundice by month or year. مرات نعتبر البرورايتس هي one presentation، يعني تجيك فيميا only pruritus. لما نسوي الانفستيجيشن تلقى عندها primary biliary cirrhosis. Second, third, jaundice. It's a clinically presented feature, maybe the only presented feature. Sometimes the female come to you only jaundice. نسوي الانفستيجيشن تلقى عندها primary biliary cirrhosis. Fever, abdominal discomfort, and rigor. This نسميها charcot trial. Charcot trial indicate there is an inflammation of the biliary system. Complication of primary cirrhosis by infection, fever, abdominal pain, and rigor. Second, malabsorption feature. Because chronic obstruction lead to fat malabsorption, lead to malabsorption syndrome. So the patient present with diarrhea, steatorrhea, and feature of osteomalacia and osteoporosis due to vitamin K deficit. Maybe lead to weight loss, xanthelasma, Xanthelasma due to retention of the cholesterol due to poor synthesis of the bile salt. The xanthelasma is deposition of the cholesterol in the eye or deposition of cholesterol in the elbow and the hand creases. Other feature of the primary biliary cirrhosis here hepatosplenomegaly due to portal hypertension. Other feature of liver cirrhosis and its complication may be present. Associated disease, because the primary biliary cirrhosis is autoimmunological in origin, so associated with other autoimmune disease, example, Zika syndrome, celiac disease, thyroid disease, vitiligo, and so on, may be associated with. Investigation of primary biliary cirrhosis, liver home test نلقاه cholestatic pattern. شنو cholestatic pattern؟ يعني الالكالين فوسفاتيز and GGT more than AFT and AST. والبيليروبين mainly conjugated type. Other tests نلقى hypercholesterolemia. The cholesterol increase in the serum due to poor synthesis of the bile salt lead to retention of the cholesterol in the blood. Other anti-mitochondrial antibody are positive more than antibody. So the gold standard for diagnosis هي الانتي-nuclear anti-mitochondrial antibody نلقاها 95% positive. To confirm the diagnosis ERCP اللي هي endoscopic retrograde cholangiobacteriography or sometimes need liver biopsy to confirm your diagnosis. Ultrasound of liver to exclude it of secondary biliary cirrhosis. لازم نسوي ultrasound حتى نشوف انه ممكن يكون secondary cause, example gallstone, any surgery lead to obstruction of biliary system or ambulatory tumor, all lead to obstruction of biliary system lead to secondary biliary cirrhosis. So ultrasound to exclude it of the secondary cause of biliary cirrhosis. How to manage of the patient with biliary cirrhosis? No specific treatment is available. Sometimes use orthodeoxycholic acid, 13 to 15 milligram per kg per day, maybe lead to improve malabsorption and improve obstruction. A treatment of complication, example, pruritus or malabsorption, treatment accordingly. Pruritus recently cholestyramine, 4 to 16 gram per day orally, or rifampicin, or ultraviolet light to decrease the pruritus. Malabsorption, example, who decrease fat intake, monthly injection of vitamin K, supplement with vitamin D, supplement with calcium, because these fat soluble vitamin not absorbed due to chronic obstruction. So should be supplement. Should be excluded of secondary biliary cirrhosis. Secondary biliary cirrhosis, there is a chronic obstruction of biliary system and with fibrosis and inflammation of the biliary system and with cirrhosis due to secondary cause. Secondary cause may be due to gallstone, common bile duct stone, anything that obstruct the biliary system. A chronic obstruction with a chronic inflammation and with cirrhosis. Commonly, the patient present with digital clubbing, xanthelasma, xanthoma, and all feature of malabsorption, and all feature of liver failure and liver cirrhosis. This treatment of primary treatment of secondary cause, example, removal of stone, removal of a tumor, or sometimes use of stent, together with use of proper potent antibiotic use. Other cause of cirrhosis called primary sclerosing cholangitis. In this disease, there is a fibrotic obliteration of intra and extrahepatic biliary duct system. The cause is unknown but may be associated with other autoimmune disease, example, ulcerative colitis or retroperitoneal fibrosis. A clinical feature of this patient, the patient presented with jaundice, which may be fluctuated or intermittent feature with pruritus and upper abdominal pain. Secondary biliary cirrhosis may be a result from the primary sclerosing cholangitis. This is strongly associated with cholangiocarcinoma and progress jaundice. sometimes present with anorexia, weight loss, and suggestive of this complication. دائما primary biliary cirrhosis there is high incidence of the cholangiocarcinoma. شلون اتوقع انه cholangiocarcinoma occur when the patient develop deep jaundice, rapid weight loss, and loss of the appetite. That means the patient complicated with cholangiocarcinoma. How to investigation with primary sclerosing cholangitis? Investigation of choice هو ERCP. ERCP which typically show narrow irregular obstruction of the extra and intrabiliary duct. نسميه beading محبب أو مثل السبحة. Or confirmed by liver biopsy the appearance of fibrosis around the bile duct, and laparotomy may be needed to exclude the cholangiocarcinoma. How to manage? No specific management of the sclerosing cholangitis. Antibiotic can be used to treatment of any infection. If the advanced liver cirrhosis, treated by liver transplant. This picture shows patient with jaundice. It's a product of the heme مثل ما قلنا. هنا نشوف obstructive jaundice. This patient present with itching, female present with itching, and there is a greenish to yellow discoloration of sclera. This case, primary biliary cirrhosis. Female with jaundice, primary biliary cirrhosis. 46 years old man presented with ascites and jaundice. Started 3 months ago, has been diagnosed hepatitis B 2 years ago, but had no follow-up. So this case, advanced liver cirrhosis is due to a chronic hepatitis B. A chronic hepatitis B infection lead to complicated to the liver cirrhosis and develop all the stigmata of liver cirrhosis. As you see, there is gynecomastia, ascites with pulmonary erythema and Debiterian contracture of the finger. This is purpura in the arm. There is a bleeding tendency in the gum due to decrease the coagulating factor. Maybe bleeding from nose, from the gum, ecchymosis, and the skin due to bleeding tendency. Physical finding in this picture, we show there is KF ring in the eye, اللي هي feature of the Wilson disease. Spider nevi in the upper torso. In the nose, هذه telangiectasia. The eye, there is obstructive jaundice due to liver cirrhosis. This picture shows digital clubbing, pulmonary erythema in the lower picture. On the other hand, there is Debiterian contracture. Debiterian contracture, one feature of the advanced liver disease. Then, so clubbing may be in secondary biliary cirrhosis, where pulmonary erythema and the patient with advanced liver cirrhosis. Oh, thank you very much. Any question?